Examine financing charity. Conchetta Bastion, Herzing University, Dr. Reilly, um, September 17th, 2023. Introduction. ABC Hospital has an inclusive pliability to initiate our own desirable principles for charity care to support the community. Most households of the community's income is $40,000 or under, and some has extensive medical debt ranging from hospital stays to emergency visits. Providing care for patients at an affordable cost which will be beneficial to a large number of adults who are uninsured or underinsured with limited coverage. To acknowledge the complaints and frustration from patients and providers, policymakers have investigated the options needed to build the requirements of ABC Hospital Charity Care, which will ensure patients receive effective and correlate with care. The Charity Care Program will supply discounted or treatment at no cost to eligible patients who are not able to afford services. The demographics and percentages of ABC Hospital patient population receiving charity care in the fiscal year of October 1st, 2021 to September 30th of 2022. Before ABC Hospital regulates the, the policies of the charity care, we will need to first determine the demographics and percentages of patients eligible for charity care. In our community, the real median household income in 2021 poverty rate was at 10.6%. At this moment, the percentages of people with health insurance is 81.6%. Meanwhile, the people without health insurance coverage is 16.3%, and an estimate of 7.1 of people with limited insurance coverage. According to the United States Census Bureau 2022, in 2021, private health insurance coverage at 66.0% and 35.7% respectively. Some people may have more than one coverage type during the calendar year. Of the subtype of health insurance covering 54.3% of the population for some or all of the calendar year. These demographics are proven factors of these patients that does not have coverage that will need financial support to receive their treatment. Concerns that has played a major part in organization of the ABC Hospital charity care provision. The motive of ABC Hospital is to serve the community. All extra funds provided should be exhausted on spending in the community programs that will have an effect on the people's health. Instead of expanding the hospital or increasing salaries, ABC Hospital would rather invest in addressing one of the social determinants of healthcare, which is financial capability and literacy of healthcare costs. We can improve these conditions by number one, educating patients on charity care and those who are eligible. Number two, investigate where any extra funds is being spent and determining if the program benefits the patients. Number three, examining the community concerns such as socioeconomic statuses, the education and knowledge of the patient, and social determinants of health. Eligibility for ABC Hospital Charity Care. Eligibility for ABC Charity Care will be determined for patients who does not have health insurance, disqualified for any government health programs such as Medicaid or Medicare, and those who are unable to pay for their treatment based on social determinants for financial support. Eligibility will be based on individual patients and families' financial needs and shall not be taken into account of age, gender, race, social status, sexual orientation, or religious affirmation. Orders and methods of how patients can apply. Patients can apply online on the ABC's hospital website, or patients can come into the hospital to have patient resources representative to support the patients with applying for the charity care program. Included in the application, patients will require to provide financial documentation, suitable efforts of other sources of payments and coverages, and documentation of patients' outstanding accounts receivable for previous services provided. The need for financial support will be evaluated by administrators or at any time additional details pertinent to the patient's eligibility for charity care. Innovative ways for patients to utilize ABC Hospital Charity Care. To qualify for ABC Hospital Charity Care, patients are asked to share their household size and income and other financial details. Providers and hospital staff can support patients with this information by using the presumptive eligibility screening. Stated by Hethage, 2014, to make an accurate assessment of the permissibility of the use of presumptive eligibility tools, it is essential to recognize at the outset that the Centers for Medicare and Medicaid Services CMS administrators has clearly stated that the parameters set down in CMS manual for determining indigency for are mandatory and not merely suggestions or examples. Benefits for ABC hospital plans for balancing the needs of patient population. ABC Hospital will establish 3 benefits to focus on the financial capability of health moving forward. There will be links on the hospital website and contact information about the charity care program. ABC Hospital will provide a summary of the charity care policy when patients begin their intake process. ABC Hospital will display and post charity care financial policies around the hospital for patients.